Well, my guest today is Alice Taylor, and she is CEO of Broward Health Imperial Point. They're located over there in Fort Lauderdale, and I have to just say that when you meet a CEO of a major health institution, you just don't picture someone to be like Alice Taylor. She's charming, she's beautiful, she's effervescent, and yet she's so smart. And so we asked her to be on our show so that she could tell us just what makes her hospital just the wheels run so well there, Alice. So welcome to the show.
Thank you, Anita, and thank you for this wonderful compliment.
Well, it's true. I mean, besides your great gift shop that I always brag about, the people at your particular hospital are so kind and helpful, whether it's the janitor or a doctor. What is it that you do to them?
Okay, well, first of all, I would like to tell your listening audience that we are a Broward Health Imperial Point. We're one of 4 hospitals within the Broward Health system. What distinguishes us from some of the other hospitals is that we have a we're a community hospital. We're licensed for 204 beds. We run an average daily census of about 125. And we are the community hospital for the primary service area in our community. What differentiates us? I hope that people have seen our man van. We actually initiated that program right after I became the CEO of this fine institution. And the man van is actually a bus that goes around to communities and does screening. We initially targeted men because we found out that we really didn't have any programs for men, like you see many of the healthcare systems advertising for women's services. So the man van was created under my leadership with the help of my team, and actually the entire idea came from one of the members of our staff. So how do I get the staff involved? That's the key. Communication, listening, and really engage in your staff. The people who are on the front line have a lot of ideas. Customer service is an initiative that all of our Broward Health hospitals have, and here at Broward Health Imperial Point, we continue to uphold those standards. Everybody greets everyone with a smile. They're very friendly. I never have an issue when I'm walking down the hall that there isn't one employee that doesn't greet me, and it's not because of my status. I watch them do that for everyone.
So I guess I just want to ask you a question. So how does someone like you even get into the field that you're in now and in this position? Are you a medical practitioner?
Actually, I'm a nurse by that was my initial career. I started nursing in 1977, or I graduated from nursing in 1977 with a bachelor's degree, and quickly, about 2 years later, I received my master's degree in nursing, specializing in burns, emergency, and trauma. Back then, not too many people in the early 80s had their master's degree, and I found myself quickly being asked to take leadership roles. And then I went on to get an MBA because I felt like I really need that skill set to talk with the big boys in the boardroom. So that's kind of my background, and I've had a variety of jobs throughout the year that have prepared me for this role.
Well, that's why I understand now, why you understand what really goes on in a hospital, and why if there are any complaints, you just head right on to it and you say, okay, we're going to take care of that. And I've seen you in action, and you really are quite a dynamo. So I applaud you, and I know you have a big job there because we all understand about budgets. We all understand about the affordable health care. We know that things are working. You know, you have to be very careful, but you are on track and doing better than you had even proposed to your, I guess, superiors.
Yes, actually, last year we had quite an unfavorable financial picture when we finished our fiscal year, which runs from July 1st to June 30th. But this year we have absolutely turned it around, 360, and we're favorable to budget for our finances, our bottom line. We also have reached our targets for customer service, but we still have some room to grow. These were targets that were set internally, and also we have done very well with our quality initiative. It's a whole new team here now, really engaged. We're working very diligently on our strategic plan. This year, as the previous year, we're focusing on the Medicare and managed care population. I would like to mention, if I could, our senior-friendly initiative. Our nurses are trained as niche nurses. That's NICHE, Nurses Improving Care for Health System Elders. It's a nurse-driven program that we joined to meet the growing needs of our senior population. Most recently, we developed a plan to open 5 rooms in our emergency department that are senior-friendly. And unlike you come to an ER and you're on a stretcher that has a thin mattress, we are offering our senior population a room where we actually have a bed with a normal mattress. We also have a recliner for their significant other to be as comfortable as they are. And we have a TV in the room and a large clock. And with the training of the nurses, this blends very well with our overall strategic plan.
My guest is Alice Taylor, and she is the CEO of Broward Health Imperial Point, located in Fort Lauderdale, right on Federal Highway. I have to tell you, as a gerontologist, you are just making me so happy, and I am aware of the things you're doing because that's always been my major complaint, that the elder population does have different situations and problems, and for you to understand it and appreciate it just warms me up so much.
Thank you, Anita.
So what I thought we could really talk about, too, is people don't really understand, I think, what happens in a large facility, a large institution as you have. So there are doctors, and are these doctors a part of Imperial Point? Or are they outside doctors? How does that all work?
We actually have a variety. We have doctors who are employed by the Broward Health System, and they're assigned to Imperial Point, and we call them the Broward Health Imperial Point doctors. It's a physician group. They are internal medicine and family practice doctors, as well as we have some surgeons employed through the physician group. Then we have our doctors who are our community doctors that have been loyal to us over the years, and they're surgeons, internal medicine doctors that prefer their patients to come here. They have their own private practices, and although they practice here, they're not part of the physician group. Then we also have contracted services. For example, our emergency department is contracted through a company that was called Phoenix Physicians, and now they recently merged with MCare. But it's the same physicians that have been serving this community for years. We just recently appointed a new medical director in our emergency department that's young and bright and really very interested in moving us to the next level in care in the emergency department. We also contract for anesthesia services as well as a radiology service. And this is a contract that we have been working with these doctors for years. And then we contract, they bring in the specialists for us, radiology, emergency medicine, and also anesthesia, the contracted services. So there's definitely different groups that serve our patient population.
I don't know how you can keep track of all this. And still have such a cheery attitude. You know, you are highly organized, but I think you have a great team, as you said, and everybody's so loyal and so uplifted. I particularly have a great relationship with Kenneth Wong, and he is absolutely one of the finest marketing directors I have ever met. I mean, I go to a lot of your events where you have 70, 80 people, whether it's in the summer, no matter what time it is, you have great lecturers. I mean, I just think it's all working there.
It definitely is, and that's the key to success, is you have to surround yourself with the brightest and the best. And you can't let brighter people than you intimidate you. You need to embrace them because it takes a team. It's just really, although I'm at the helm, I rely on the people that work very closely with me. I have a wonderful chief nursing officer, excellent chief financial officer. My director of quality is he comes from New York. He's bright, knows his stuff, and that's important, the people that surround you.
Well, I'm Anita Finley, and you're listening to the Boomer Time Show, and as I said, my guest is a charming, very, very intelligent, and very successful CEO of Broward Health Imperial Point. The other thing that has impressed me is you have an incredible community relations group that meets, I think, usually every month or maybe every 2 months. I don't even remember. It just seems I like to go there. But it's what you called the community. It does bring in, there were fire chiefs and the police, the sheriff, and people from all organizations. The doctors come in. What is the value and point of that in your own words?
How it values me as the CEO, and then I'll talk how it values us as a hospital. The value that I place on that meeting is priceless. The input that we get from the community really helps us drive our strategic plan of how we're going to plan for growth over the next year. They give us suggestions and ideas what's missing in the community as far as healthcare needs are. We are moving to a whole new era in healthcare where we have to really look at population health management, keeping the patient out of the hospital. So they bring great ideas. It's a networking group. They have contacts in the community. They will bring stories, whether positive or negative, to the table so that we can sort through them. And for a hospital, it's just invaluable. They could tell one good story to 10 people. That helps us tremendously.
And so, what would you say the greatest challenge for you as someone running a huge hospital like that is?
Keeping all the pieces together. Finance is very important, the financial health of the institution. Oftentimes people say no money, no mission, but really it's balancing the finances with the needs of the community, balancing with customer service and quality, because we want to deliver a quality product and meet the needs of the patients we serve.
And people are always a little confused if they are picked up, in an emergency vehicle, and they want to go to Imperial Point, but they're not driven there. How should they handle that?
Well, the EMS system in our county, they have strict rules that if it's an emergency, a life-threatening emergency, they must take the patient to the nearest hospital. So they would, if they were coming up Commercial Avenue, they would go to our neighboring hospital, Holy Cross. If the patient requests to go to Imperial Point and it's not an emergency, a limb or life, they can bring the patient to Imperial Point. And if they refuse to do that, there's nothing you can do much at the time, but you certainly could follow up with the either myself or the fire chief, and we can sort out the reasons why and get that information back to the patient.
So if a person, though, has something that's scheduled, but they don't live near you, where your hospital is, they can still come to you?
Oh, absolutely. They can come by car, by public transportation. If they're in a assisted living facility or a community, they can get transportation from there, or they can, if they're not ambulatory, then they could order like an ambulance, one of the private companies.
So, just going over some of this, one thing I did want to mention, and I didn't get a chance to because you were so enthusiastic about it, but the niche, which we wrote an article about it in our June issue. For those of you listening, if you would get Boomer Times in front of you, and on page 3, you'll see that there is something very important for you, especially if you're an elder or if you're a caregiver for an elder. It's one of those incredible programs, and is it the NICHE, of course, and you said what it stood for, and I have it here, but Geriatric Resource Nurse, Geriatric Care Nurse, right?
Well, actually, the niche.
What does the niche mean?
It stands for Nurses Improving Care for Health System Elders.
Oh, yeah, I see that. So that is a designation for you. Now, do other hospitals have that?
Some of our sister hospitals are in the process of applying for that. It's the nurses have to have so many education hours, and then you have to demonstrate that you have policies in place to support the needs and the care of the elderly.
That's great. I hope that, I really hope a lot of hospitals, whether they're Broward Health or whatever they are, just let's get it, because we probably between, I suppose it's children whom we are concerned about and elders. And when they wind up in the hospital, there needs to be more sensitivity. And just what you're doing is perfect. I remember taking my mother to the hospital, and it was horrendous. And then while I was there, of course, I was there helping her. But you know how many people were lying on, this wasn't your hospital, but lying on the beds, just waiting for someone. They were scared. They were cold. And it wasn't because people were uncaring. It just wasn't high priority.
Right, right. And that's that's going to differentiate us, that they understand the needs of the elder, that they have different temperature control than somebody from age 20 to 50 or 60, and we need to make sure that they're warm. We have to make sure that we speak clearly and concisely, not shout at the patient because we think they're hard of hearing, but really elicit that information, be kind and respectful. It's a different generation, and we just really need to adapt to their standards, their values, and how they grew up.
Yeah, well, and other things. I've done a lot of sensitivity training for many institutions, and it's amazing how many people in the medical field do not understand if someone has macular degeneration, or they do have hearing impairment, or they have arthritis, or so many of the typical ailments, that it makes a difference. And then they just think that they're angry and they're upset and they're mean. I mean, it's very sad.
Yes, it is. But we will change that.
Good. So I also, all these are little tips and things that since I've been doing this a long time also, for years, there were no valet parking people out there in the front of hospitals. And I noticed you have valet parking, and it is so wonderful because, for someone who's just going in casually, they can walk from the parking lot, which I think is also good because they need the walk. But many times people are coming out with wheelchairs, and it's very difficult. The person has to leave them. They have to go get the car. But this is a whole new field, isn't it? But I have to assume you pay for it out of your budget.
Yes, we do. And we do offer free valet for all the patients that we serve. And anyone can take advantage of it, young, old, in between.
Right. And that's really great. Now, what will you be doing if a hurricane comes? What do you do at the hospital?
Well, actually, we have a very structured hurricane plan. The people will either be on the A list or the B list. The A list are employees that will be in here during the hurricane. The employees that are on the B list will be in after the hurricane. We give our employees time to batten down their hatches before they come back to be on duty until it's all clear. And what we open up to the community is we try to discharge as many people as possible so that if there's any disasters in the community, we're able to accept them. Our emergency department stays open until the very last minute. When we know that fire rescue no longer is traveling, then we close our emergency department so that, because that's all glass and it's all hurricane proof, but still it can shatter. It won't break through. So we definitely have a structured plan. So we are here. There's a team here from administration all the way down the organization to care for the patients who are here and who come through our doors during or that time or before.
And I have heard that people like to buy homes near hospitals. And you know why? Not because they're afraid there's an emergency, but because if the power goes out, you get your power fixed first.
That is true. Although in 2005, when Wilma hit, I was in the county. I was actually at a Broward Health Medical Center, and poor little Imperial Point got hit the worst during that time. And they were out of power a little bit, but it was turned on within hours. I don't think it was a full 24 hours. So, yes, the neighbors benefited from that priority.
But, of course, you have a generator, as we said.
Yes, we do.
Yeah.
Yes. And that snaps right on.
Right. And of course, something else that I saw, and we haven't talked about that, we have a little time, for people having knee and hip surgery, you now have a very special area for them.
Yes, we do. Not only is it a special area, but we were fortunate to complete the whole area on the 5th floor. We remodeled it. We have private rooms, and the joint center area is very close to a gym for rehab, and we take the patients in groups there. And it's kind of nice because they compete against each other about who's going to be able to bend their knee, different degrees.
That's great.
And it's just very it's great. In fact, we're going to have a open house in August for our returning joint patients, because it's been in August will be 1 year since we opened the center. But also we're going to have a housewarming to invite the community and to see the rest of that floor that's completely remodeled.
Yeah, that must make you so happy. I know you work so hard.
I know. That was my passion, to get more private rooms and up to date, and they look beautiful.
Yeah, and of course all this takes money, and so I do have to put a different hat on. The Broward Health Foundation, which works very hard to raise the funds for Imperial Point as well as all the other Broward Health institutions, the hospitals. So if you're thinking about leaving your will, leaving something in your will for somebody rather than all the big cars and boats you leave to your grandchildren, why don't you leave a little bit to the hospitals? Broward Health Foundation begs you to remember them, because I think you do become immortal, don't you? Now, you have something else there. I was there. Now, I'm trying to remember. There was something new that was installed in your hospital. I guess that's really what I was thinking about when I went and saw.
We recently installed a new CAT scanner that is a lower dose radiation in our radiology department.
Yeah, now that's something that people have been concerned about now. So that must be a very expensive piece of equipment.
Yes.
But
yes.
It must be very important.
Yes, the project was over $1 million to rebuild and to bring the machine in. Well over $1 million.
And so what happens, though, I guess, when you're dealing in hospitals, as you are, and there are so many different things that you can spend money on, Alice, and I guess it's up to you which is the most important, maybe what your neighborhood, who you're serving, and what their needs are the greatest?
Mm-hmm. We definitely have a priority list that actually that we use here at Broward Health Imperial Point, and it really looks at what is life safety. That's the most important thing. For example, if the sprinkler system did not work and we had to replace that, which is very costly, that would be a high priority, because it is a life safety issue. If we had a fire and we didn't have a sprinkler system, we could affect a lot of lives here. So that definitely is a priority. The next priority we have is anything to do with patient safety. So those are very tightly aligned. Life safety for the majority of people, then patient safety for any individual patient. If this piece of equipment is needed because another piece of equipment is outdated that may, in fact, injure a patient, we would immediately replace that. Then we look at our strategic plan, what we have decided to budget money, and we also look on our return on our investment for different pieces of equipment. Years ago, when I first started in leadership roles, it was like what a physician spoke the loudest and what administration the most got the piece of equipment. Now we really have a very solid process, and in my experience over the years, when all the doctors know how they're categorized, they understand that there's just so much of a pool of the money and that we have to allocate it. And we have been the system has been very generous with their capital. We're constantly updating, improving, and the doctors do get what they need for their patients. We do have the latest technology throughout the system. So it's all about prioritization and also keeping ahead of the technological curve, because we want to have the latest and the greatest that the consumers are expecting.
I would like to go back, because we started it with the show with the man van, and I'd like to talk a little bit about that. So if our listeners want to have this van come to their condominium or some event they're putting on, all you have to do is call them at 954-776-8500. and you could ask for Kenneth Wong or the marketing department or the man boss.
That's Todd.
Right.
Todd Moritz.
Right. And I have to say that was a really brilliant idea, because you're right. We women know, yes, we have a lot of problems, and women's health has been high on the priority list, but we want to take care of our men, and this is a very nice van. No one's going to do anything to hurt you. It's really just screening. What actually do they screen for?
They actually do, of course, they do their blood pressure and their pulse, and we have recognized extremely high blood pressures and had to send patients from our van to the nearest hospital if we were out in the community. Or if they come in, they can also walk in the door and get the screening as well for $75. Some insurance companies pay for it. They look at, there's 10 blood tests that they draw, including a PSA and a testosterone level for men. And then your blood sugars as well, your liver enzymes, your regular electrolytes. That could be a sign of that there's some type of disease brewing. But really, the blood pressure and the pulse, weight and height, they do, as well as the other tests that normally a doctor would order if you were getting a physical.
So how far will the man van go? I mean, if someone's in South Broward, would they go down there?
Yes, we actually have been in Miami at the request of a company. Yep. So
wow.
And this Friday, we will be in the Plantation 4th of July parade. The Nancy will be in there.
Oh, you're going to decorate it?
I don't know. I don't know how creative. Kenneth is on vacation, so I'm not sure how creative they'll get.
Well, Joey's pretty creative.
Yes,
he is the person that I know is the second command there. That's excellent, because I think that really is a nice way for Broward Health Imperial Point to get their name out. But at the same time, you're doing something really important, because we know that men don't want to go to the doctors unless their wives prod them. So I have to tell you, this has been just absolutely delightful. I'm so glad, Alice. I know you have a lot of meetings, but thank you for sharing everything about Broward Health Imperial Point.
Well, thank you for having me on your show.
It was wonderful. Have a great holiday.
And you too.
All right, bye.
Bye-bye.